Okay, we have got 2 new dogs this week that were a surprise to me. The shelter emailed and said that granddaughter brought her grandfather's dogs in because he was going into assisted living. They were super stressed at the shelter, and they are 2 apparent seniors, Molly and Sandy, that were not fit for the shelter at all. So we went ahead and got them, and as you can see, Molly is doing a typical dachshund thing and hiding. Sandy is about to rip her skin off because she either has tons of fleas, well, she has tons of fleas, but it's either just the fleas or fleas and mange or something else going on. So we're going to get them out and get started because she is killing me with how much she's itching. We want to get her some relief pretty quick. Sandy! Sandy, is that your name? So good. Do you have some fleas? Pretty babies. Oh, those nails.
Oh, those nails.
Girl, we get your nail done. Oh my goodness. Look how bad her skin is. Oh. See her belly. Those nails, girl. Oh. We've just been watching her just tear herself up in her cage.
Look at these nails.
Look at her nails.
Ooh, look at her tail.
Oh.
Look at her little tail.
So when we called with her rabies tag info, they said she was 5.5?
5 years, 5 months.
5 years, 5 months. Got all those sleeves on her head.
Name is Sandy. Sandy, I'm a dandy.
Really?
Name is Sandy.
I think she's older than 5. I'm not saying that she didn't just
They
have
had a
bad,
birthday.
but look at that. Poor baby. Still got old lady teeth.
I don't think she's probably had food.
She's got that line of hair that's stuck in her roots.
It's going to be a good, rewarding dental for everyone
She's
involved.
got one incisor that's coming out.
She's got a cherry eye.
She's got this cherry eye here, which is a prolapsed third eyelid. We're gonna have to fix that. You could be so cute. Look, could be so cute. Oh, poor baby. Man, so we're gonna skin scrape her first because we just need to rule out if we've got mange or not.
Can we cut off this flea collar from 2017?
Yeah. It's almost like it's a collar.
It's a mummified
it's
collar.
So old.
Oh, look at the inside of it. Ooh, gross.
The nails, man.
Your dog's IPS is negative.
Thank you. So what we were doing with scratching the ears is like this pedal pinal reflex with sarcoptic mange. A lot of times if you scratch the ear margin, they'll start itching. It's pretty, I don't know, they say it's really reliable, but I've never been a big...
Hers is ambiguous.
Right.
She's just so itchy
She's itchy
everywhere.
everywhere. How could it be a positive?
She's so greasy you can't tell.
Right? That's sad. I'm gonna do superficial first, lots of areas, broad area, checking for sarcoptic mange. As I feel like I'm getting all the flakes on you as I'm doing that. I'm sorry.
It's alright.
And then we'll do a deeper one. When we check for the demodectic mange, basically we want a little bit of a deeper skin scraping. So we'll pinch the skin so that the blood comes to the surface, and i.e. the mites that live down in the hair follicle come to the surface. That's what we're going after. Which I don't think it will be hard to get a positive if she's positive for DX.
Here, shoulder.
Yeah. See a bath in your future, Sandy. A lot of baths. Here's what we look at when we're looking at the skin scraping. You just see all these little hairs in there, and then we look for tiny little mites moving around, and both of those scrapes are negative, so probably just a really severe flea allergy. So we're gonna treat the fleas and put her on a short course of a steroid. Okay, here's sister. She was growling at us because we took Sandy out, but her name is Molly. She's a little chunky, huh? She's super scared. Her teeth are so bad. Uh-oh. Uh-oh, that's like got the teeth. Take care of your pet's teeth, people. This is gonna need a lot of extractions. Poor baby. Fleas everywhere, not surprising.
Fleas everywhere.
We have no history on age. Chubby.
You got the blood over here, right?
Yep. Oh, her little toenails are crossed in the back. Like that happens to her all the time. That'd be so frustrating. So we said the other one was spayed. I think this one has a space guard too.
God help her, she's not spayed.
Huh?
God help her, she's not spayed. She's chubby.
She's got small little memories too. Heart's good. So her sister needs to gain weight. She needs to lose a little bit of weight.
So she's eating her sister's food.
Like, we are going to get blood because we know that we're going to end up needing her teeth. So we're getting
What do you want to do first?
prepped.
Blood or
Yeah.
vaccines?
Do the vaccines first. So
See
we're
how brave
getting
you are.
prepped for surgery.
Good job.
She's like, talking about surgery already? We can
Like,
talk
I
here.
don't even know your name.
No. All right, so she's got to sit for 10 minutes and then we will wash this shampoo off. Just rinse it as we go. Oh, are you mad at me?
You look so good. Do you feel good? Do you feel better? Oh, I bet you feel better. Oh, it's a good girl.
And we have a bath. We have a bed. Much better. Hey, where's your sister? Hi. So cute. Here's the blood work from Molly and Sandy, and everything looks pretty good. We have, first of all, Squeaky getting on the papers. This is what happens anytime I'm at my desk. Squeaks. Oh, geez. We have a problem. Anyway, I'm not going to go through showing it to you because they're going to make it difficult. Everything looks pretty good. There's a high white count and some liver values elevated. I believe most of that is due to the horrific dental disease. But the important thing also is both of their thyroid tests are normal. and their heartworm tests are normal. That is the most important thing because we don't have to go through heartworm treatment on them, which we frequently do on these kind of neglected cases. So, okay, are you happy? I'm petting you now. Oh my goodness. Oh, he's not happy. You happy? Are you happy? Underwhelmed. We are gonna, look, they're so happy. Hi. It's time to do their dental cleaning. Let's see how that goes. And we'll fix that eye too.
We are pre-matting Molly for her dental. Bam.
So we got the tartar scraped off, a couple things. Sorry about the noise, that's just the way it is around here. These incisors are probably gonna need to be extracted. This one's done, look at that. One's super loose. This one has so much root exposure, it's very loose. Root exposure. This one actually has a slab fracture. So I'll show you what the normal tooth looks like, but this is basically sheared off, and we didn't even know that until we got all that calculus off. We'll have to see what the RADS x-rays look like on this one. Lowers don't look nearly as bad, except look at these incisors. It's like on a little stalk, poor thing. If you remember gingerbread, people are asking what happened to her jaw. When you have this much, basically periodontal disease, that's all bacteria. Then it goes to the bone where this tooth is connected and then continues to eat away. It secretes enzymes that will cause bone lysis until there literally is no bone. So that's what happened to G-Bread. That one's toast. We'll look at the x-rays for the rest. Okay. Here are the x-rays, and you can see this canine is just so eaten away. And then this little pocket right here is just a pocket of pus, essentially. Same thing with these molars. Here's another one right here. Just so many of these teeth are bad, so that's why we have to extract so many, unfortunately. This one is interesting because you can see how much bone erosion there is. Like the bone should come up to here where the crown starts, and this is all just exposed root. Poor pups. Same as this one on Molly. Them's bad. Have you seen those things that little kids, like you save their teeth from a tooth fairy and then you can put it on like a weird little, have you seen that?
A pillow.
Stuffed animal, and it makes it look like it's their teeth. It is the creepiest thing. So now I am going to, I flushed all that out, I'm gonna suture everything up. But like about how you have to have, if you want a AO fistula flap to stay closed, you need to meet these requirements. Like this many millimeters between, and you have to take a bite of this and a bite of that, you know, that I hadn't heard of before, or thought of before. And she's like, and 50% will still come out, so. Got a little bit of bloody drool. That she's in a little burrito, staying warm.
She's so cute. Even though she's, look at her little wrinkly butt and tail.
Oh, no. I'm so sorry I have to poke your little cute butt. Oh, no. Turn around. I'm so sorry. Oh, no. I'm so sorry. Oh, no. I want my mommy. Your mommy's sleeping, having her teeth cleaned.
She's cute.
Goodness, yeah.
So these teeth are terrible. I thought they weren't gonna be as bad as Molly's, but they are. That's all just exposed roots, and then we'll get all that calculus off so we can see it. That thing is just like, just pull me out, please. I don't know what's gonna happen down there, so let's just get started to figure out what we need to do. Okay. Oh, God. When there's all that hair, it just grosses me out so much. Look at that. Oh, man. Her eye looks inflamed right now, so we commonly have where people pick up and they're like, it's still there. But it's actually just inflammation of those membranes, but not prolapse. So that'll take a while to go down. Get a good girl. Oh, still seeing pink elephants for a little bit. Goodness, it looks so pitiful.
So pitiful.
Well, they have an adopter, and he is actually going to foster them for the rest of their medical care. while we get Sandy's skin cleared up, and he is gonna come pick him up tomorrow. He's so excited to start bonding with him, and we could not be happier with the adopter that they got. Because they get to stay together. That was not even an option. But your hair's already looking so much better. It's growing back, Sandy. It's growing back, Sandy. Yes. What are you doing out here? Are you rolling in the grass? Oh, goodness. Molly needs a belly rub. Molly needs a belly rub. Sandy. Goodness gracious. Oh, goodness. I'm so happy. My teeth are clean. Like my teeth don't hurt anymore. She fixed my eye.
Goodness.
Oh, your eye looks good.
Awesome. Oh my goodness. Yay. Oh my gosh, you guys are so cute.
They are. See, I'm a fat little wiener dog. You're the cutest.
They're gonna have so much fun in their new home.
I know. Sing together? The cat sister? Oh, I know. That's lovely.
I like Chunky. Isn't that right, baby girl?
And that? Here.
And they're both girls?
Yes. All right, we're rechecking Molly and Sandy today. They're in a foster home now with someone that loves them and is going to be the adopter. Teeth are healing up really, really nicely. Very good. He did say that Sandy was pretty itchy, so we're going to recheck her skin today too. And when you take her back, will you ask him if he has any shampoo at home he's baking with? Okay, we'll see. We're going to recheck him again in a couple weeks. Okay, let me show you our little girl. She's so cute. Sandy! Said she's itchy. Her hair is growing back really nicely though. Did you just drink? Oh, she got sick in the car. Poor baby. We'll give her some Serenia for the ride home. Her eye looks good. It's a little crusty. We probably need to send some eye ointment home too. Oh, baby. Oop. Her eye's a little crusty, so I'm gonna send home an ointment and then recheck her. Oh, look at all of her hair. Wow, look at all of her hair, guys. Okay, Sandy, okay. He's so sad. I'm gonna go hold her and give her a vaccine. So we're gonna do Perfecto, shampoo, eye ointment, and then we're going to do Apoquel. Perfecto, Apoquel, eye ointment, shampoo. Recheck in 2 weeks. Good girl. These are good girls. Molly. Sandy. She's a good girl. Well, her hair's growing back in. That's good. You know, they told us that she was her daughter.
She is.
That's what they said.
Okay.
But they also couldn't remember her name, so I don't know how true that is. Puppies. So cute. Rechecking Molly and Sandy. I can't believe it's already time to do that again. It's going by so fast. The foster to adopt said they're doing amazing at home, and that Sandy's skin is doing really good too. And then we'll peek in Molly's mouth and check her teeth and make sure that that looks good too. Our poor little Sandy gets car sick, so we're sending stuff home for her. But look at this, she's got real hair now. Look at that. It's a regular old fur. But her mouth is healed up well. She gets car sick, so that's why she's all drooly. Yes. So 2 more weeks, and then this will be it for her, I hope. So we all healed up. Just been waiting for Alex for what, 7 or 8 minutes just to take Sandy in and bring Molly back, because she's just DACA. Give it a quick nap in.
61. Oh, 3 different?
Alex!
Yeah, I just got.
You're supposed to bring Molly.
Oh, you want Molly? Oh, sorry, you know, it's like, oh my God, do not.
See? See?
1 hour later.
Oh my goodness, someone's getting a little plump up.
Say, golly, Miss Molly.
Hi, how are you two first?
He says she's loving her life at home.
Good. Those sutures are going to dissolve. He's just dropping off. I don't know. I need to look at it and see what happened. Oh, your mouth looks so good. All those sutures are dissolving. Mama.
Well, here's our happy little Molly and Sandy with their new papa. They're just having a great time at home, huh, Dad?
They are. They chase the cat from one end of the house to the other, and then the cat chases them from one end of the house to the
Oh
other.
my goodness. Well, Sandy's looking awesome, and we're glad that she's doing a lot better. And Molly, you're just being a precious girl with Miss Sandy.
Well, it's the last recheck for our Sandy and Molly. We need to weigh Molly. She's looking like she's gaining a little weight. Might need to talk to the doctor about that.
It was just Thanksgiving.
I know. But everything looks good. Her teeth are healing up fine. And he said she's doing great. There's all of her lack of teeth. Oh, good girl. All right, let's go get little Sandy. Let's weigh her real quick. Look how cute this dog is. I can't even believe it. I almost forgot she had a cherry eye surgery. And then look at all this hair. Look at all this hair. She's a real dog. Oh, sweet girl. Let's check your teeth first. Again, Drooly, hopefully this is her last visit so she doesn't have to continue to get car sick on the way. It's okay, Sandy. She's like, I just want to go back home and get under the covers. Dude, it's our last recheck of these two. I can't even believe it. This has been like the easiest, most perfect adoption and wonderfully rewarding case. Go miss them. Okay, girls. Are going home for goods? Okay, girls. So cute.
She is a cutie.
Look at all her hair grown back.
Yes.
So I was naked before. I was naked.
She was.
I had no hairs. Molly.
So they're doing great, settled in.
Oh, yes. They sit and play and have a grand time.
So good.
That little face is just too cute.
She is such a cutie, isn't she?
Yep, it's interesting to think that that could be her daughter.
I know.
Sandy. Molly.
Well, we're telling our little Sandy and Molly bye. This has been such a rewarding case for me because, I mean, we definitely changed their quality of life by fixing their mouth and just trimming their nails and fixing this little one's skin and how itchy she was. So this has been so great. Thank you guys so much for watching our videos. Thank you for subscribing to our channel, and definitely everybody who donates to Abandoned Pet Project. We could not do this without you. So thank you guys so much, and we'll see you on the next case. I know, Mama. Bye.